the epidemiology of this latest variant, so far, I don't know how familiar you are with the map of South Africa, but in terms of provinces, Gauteng so far is the most affected, the Gauteng province, and that is the economic hub of South Africa. So you've got the highest number of cases in and around Johannesburg, Pretoria, and it started mainly in Pretoria. I think there's probably university students, there's a cluster there, and then it spread rapidly. But you've also seen cases in Cape Town, so it's spreading quite rapidly across the country.
I see. So in terms of the average daily rate of increase, what numbers are we looking at?
I think we're looking at, let me just confirm, because I know that we're now, the positivity rate has jumped up from around 1% to 8%. 8%,
I see.
So that's where we are. That's where we were yesterday. So yeah, I'll just confirm the specific number as we chat.
Yeah, no problem. I'll also research on the exact number. And also in terms of the existing situation at South Africa, in terms of the vaccinated rate of the local population, what kind of levels are the populace at in terms of vaccination?
So the uptake has been very low. Hey, we've got a very low vaccination rate or uptake because there is hesitancy. So that's the biggest part, and we're hoping that at least when it comes to the elderly, we would get better uptake. But for now, I think we're sitting at around. So far, we're looking at 21 million vaccines administered, which is less than, I think, probably less than 50% of the population.
I see. Okay. Now, going back to focus on the virus variant. So, I know that this still requires clinical observations and also testing. But in terms of the information you have so far, how is this virus variant in terms of its lethality, like in the death rate it causes, and also what kind of health implications and problems you're seeing?
So far, because it's early days, it's probably with 2 or with 3, we haven't seen many deaths associated with COVID, right? But the problem with COVID is that people don't die the first week. People are going to die. You're going to see more deaths probably by week 3, 4, 5 going on. But also in terms of admissions, there's been an increase in admissions, and it's mostly those that were not admitted, that were not vaccinated. That's the main thing. Amongst the younger population where it started, the symptoms seem quite mild. We haven't seen many hospitalizations amongst the younger population, but that's probably because it's a function of age as well, because the younger people haven't had this as badly as the elderly.
I see. So far since the discovery and announcement of the new variant, people infected with new variant, as you say, were mostly young people, and they displayed mostly just mild symptoms for the moment. What are these mild symptoms?
So it's mostly upper respiratory, sore throat, headaches, part of GIT symptoms like your diarrhea. That's basically what we've seen, nothing more serious than that. But I did hear a report yesterday that there were quite a few kids already on ventilators in one of the hospitals. But I suspect that those are the children that were not vaccinated.
I see. So basically, the virus at the moment seems to affect people who are unvaccinated more. Yes. And also targets people of old age in general, like much more affected. Is that true?
Yes. So even though there's breakthrough infections, right, in those that were already vaccinated, the extent is not quite as bad as we're seeing in those that have not been vaccinated.
I see. Okay. And regarding the current studies studies and tests running on the epidemiology of this Omicron variant, because I've heard a lot of news from South Africa in terms of the waiting time before there actually a more concrete understanding of the virus can be produced. Some say it takes about 2 weeks or so. So I was wondering, from counting from now, how long would it take to actually have a more concrete diagnosis of the effects of the virus to be have?
Please come again. Are you asking in terms of the epidemiology or more general in terms of the economy? Please just ask that question again.
Yeah, I mean, how long would it take for more detailed studies and reports regarding the virus to be produced and come out and be published?
Oh, okay. So in terms of so you'd have heard in the media that you have already characterized the virus. So in terms of the mutations and all of that, that work has been done. But what might take a bit of time is the impact of Omicron on those that have been vaccinated versus those that were not vaccinated. So that might take a bit of time. Probably, I would say give it a month and a half whilst they collect the epidemiological data. But what the good thing about our organizations, the MRC, the data guys, they're very quick. The turnaround times are very quick. So maybe even by the end of December, we'll know what the impact of Omicron has been overall, whether vaccinated or not, and also stratified by the type of vaccine, because we've got Pfizer, we've got Johnson & Johnson. And then we've got those that got a booster and those that didn't get a booster. So I assume by the end of December we'll have a clearer picture of where we stand in terms of this variant.
Great. Okay, I see. I think that this mostly concludes the first part, the first topic. So we'll proceed to the second topic. So
okay.
regarding...
So maybe also there, before you go.
Yeah.
You may want to visit the NICD website from time to time, even beyond this interview, because there you'll get more information in terms of how this variant is progressing. It's called NICD, South Africa.
Okay, that's very helpful. Thank you very much.
Okay.
Okay, now moving on to the topic of healthcare resources. First of all, I would like to know basically the situation of the say hospital healthcare resources situation in South Africa before the outbreak and the discovery of the Omicron variant, and how the outbreak and discovery of Omicron variant may be intensified or changes the situation in the healthcare resources as well. So with healthcare resources, I'm talking about, say, ICU beds, maybe ventilators, maybe vaccines, medication, and also medical staff, etc.
Okay. So you want to know before COVID and now during COVID? Is that your question?
Yes, and also in particular during Omicron as well.
Okay. So maybe just to give you a background to the South African healthcare system, it's mostly spread. They say the resources are mostly available to those with healthcare insurance. So you'll find that even the infrastructure, your hospitals, are built in areas where there is a larger population that's got healthcare insurance, which is a private healthcare insurance. So in the urban centers like Johannesburg, Cape Town, all of those, Bloemfontein, that's where you'll find the best hospitals. But if you go out to the rural areas, there is underservicing, there is lack of resources, there is fewer nurses and doctors available to serve the population. So that's how we spread. And then now, because of COVID, what we have found from even at the peak of the waves, the shortage of ICU beds, the shortage of ventilators, even the shortage of oxygen at some point. That was an issue at the peak of the third wave, second wave, even the first wave. So I expect the same sort of situation to prevail now with Omicron. Yes, we've had time to procure maybe ventilators and build up supplies of oxygen. But if the hospitals get overrun because of the numbers, as you can see, the Omicron now is sitting at 16.5% positivity rate. It tells you that it's spreading very quickly in a short space of time. So the risk there is that hospitals will be overrun very quickly. Whereas with the previous wave, the Delta variant, it gave us time. So you didn't get too many people sick at the same time. Right now with Omicron, the way it's spread like a wildfire. So you're going to get more people sick at the same time going to the hospitals, and the hospitals will be overrun. So that's the biggest risk. What happened with the third wave and even the second wave is that there were temporary structures built, temporary hospital beds that were put around the major cities just to accommodate the overrun or the overflow from the traditional hospitals. I suspect that we may have to get there as the Omicron spreads. We're going to have to build those or resuscitate, because the way they closed down because between the waves, the demand was low. But because of the spread of this particular variant, we're going to have to open up those hospitals, the temporary hospitals, to accommodate the numbers that are coming through.
I see. So have people, or can you put a number, maybe say a percentage, in terms of how full the ICUs of hospitals are in general or in particular regions? Can you put a number on that?
As we see it right now?
Yes.
I would have to confirm for you, but what we knew was that we haven't had too many admissions. So right now, I would put it at less than 30-40%. But as the infection spreads across the country, that is likely to quickly escalate. But let me confirm the exact number for you.
Okay, just a rough range would be. I haven't heard you correctly. Is it 20-40%, or did I hear you wrong?
I was saying it's probably around 20-30%.
10-30%.
The utilization of ICU, yes. But I can get the exact number for you so that I give you more specific details. Yeah.
I see. If you can follow up on this, that would be fantastic. Thank you. Okay. So you've mentioned previously in terms of the different level of access by different groups of people to various medical resources. For instance, the difference between city and urban and rural people have a different level of access because of a difference in infrastructure. So in this regard, how will you characterize the access of people of different nationalities, say expats and maybe particular Chinese expats, access to medical resources in South Africa during this period of time?
Please come again on that question.
I was wondering, for say foreign nationals, this of course include Chinese nationals, how's their access to healthcare affected? Do they have better access of healthcare than South African nationals? What's their situation, as far as you know?
The access, yes. So, well, I don't know if you are aware of the latest issues relating to xenophobia in South Africa, where people from outside South Africa are treated differently by the locals. So there's that sentiment in the community. But when it comes to healthcare, that is not. So the Constitution, firstly, does not allow discrimination based on where you come from. So that's the first thing. And secondly, with COVID, there is there is no discrimination in terms of access. Let's say if you go to a public hospital, you will be treated there. If a Chinese national can afford private medical care and they go to a private hospital, they will be treated.
I see.
So there is no discrimination in terms of where you come from. And also it's in our best interest to treat everybody, because you turn away someone with COVID, that's sending them back to the community to spread it. So with COVID, I think the sentiment or the approach has been quite different, because the idea is to save lives and prevent infection spreading to everybody else. So from that point of view, we don't see discrimination. I can tell you that maybe for other non-urgent cases, there might be that, but it's not documented. Yeah.
I see. Okay. Brilliant. And you've mentioned, of course, the role of private hospitals here. Just give me a rough percentage in terms of how much percentage that privately owned medical resources take up in terms of the healthcare resources in all of South Africa.
So in terms of expenditure, how much we spend in the private sector versus public sector, it's almost 50-50. It's probably 49% private, 51% public. But if you look deeper into that, only about 16 to 18% of South Africans have access to private healthcare insurance, right? So that already tells you that distribution of resources is skewed towards those that can afford it.
I see, so quite concentrated.
So in the private sector, and also the resources are concentrated more in the private sector than they are in the public sector, because of, firstly, people pay more in the private sector than they would in state. And in the state hospitals, it's government, they're employed by, doctors are employed by the government, whereas in the private sector, doctors are not, they run their own, almost like running their own businesses. So they don't answer to anybody. So they can charge their rates as they see fit. Even if they work with in hospitals, they're not employed by those hospitals. So that's the thing. So the distribution, I think your question was more on the availability of resources. And then when it comes to the clinical care between public and private, for me, I haven't seen a difference, because it's the same doctors that work in the public sector that run private clinics. So the quality of care is essentially the same. What might differ is the quality of the hotel or the boarding part of the admission, like your hospital ward, the food that you get. Maybe that might be different, but in terms of the clinical care, there's really no difference.
Okay, understood. Okay, I think then this concludes the topic on healthcare resources.
Okay.
Okay, and then now I should proceed to the economic impacts of COVID. So I would like to know first of all is so far the economic impact of COVID in general in 2020 and until now, and also the particular impact of this Omicron variant on South Africans' economy. For instance, I saw news that's basically reported, say, tourism in Cape Town was heavily affected, but I also want to know in terms of the larger impacts on maybe manufacturing, logistics, other areas as well.
Okay, so I will start. Well, I'm a pharmacist, so I'll tell you more in the medical space. Then I'll move on to the rest of the economy. So at the start of COVID, we had problems with PPEs.
Yes.
And we had, to some extent, the APIs for pharmaceutical, the active pharmaceutical ingredients to make medicines with. So the importation was, the supply chain for pharmaceutical ingredients was also affected at the time, because remember, we get a fair share of our supplies from China. So at that time, because of the global lockdown and probably the demand in other countries was higher than us, because we don't buy as much as Europe, for example. So there was a delay in there were shortages in some of the pharmaceutical ingredients. And we're concerned that we would have a shortage of ARVs because we get most of the stock from the APIs from India and to certain extent from China. So that was a concern. And we did have some medicines running out, but that was quickly managed, I think, because we've got quite a range of generic manufacturers in the country. So that's the one thing. So PPE was another issue. Generally, the logistics, the supply of certain products just wasn't a challenge at the time. And in terms of the overall economy, because we had hard lockdowns. So when we started, I think it was in March 2020, between March and probably June, those hard lockdowns really had a severe impact on the economy, because what that meant is certain non-essential industries had to close down. Like, for example, the restaurants had to close down. So the hospitality industry was affected the most. Tourism was affected the most. And that has crippled the economy to a certain extent, or affected the economy to a very large extent. And we've seen high unemployment rates as a result of COVID. And certain sectors have not fully recovered, even between the waves. They have not fully recovered. And we had also things like alcohol bans, banning alcohol, banning cigarettes, obviously for good reason, because we didn't want people drinking, driving, then ending up in hospital and was just already overburdened. But what that meant is that the economy also suffered. And then we started to have black market trade, for example, in tobacco products, to some extent in alcohol products. So that was an issue. And then in terms of the airlines, they were also affected. I think we've had Mango Airlines closed down. So we've had quite a few challenges in that part of the economy because of the lockdowns. And I think in general the economy has suffered. And then fast forward to the Omicron variant. The day we announced that we had the Omicron variant, our rand dollar exchange I think we hit the lowest it has been in the last 12 months, just over the Omicron announcement. So you can see how much this COVID virus is affecting the economy. So it will take us, just when we're starting to see the green shoots in the economy, post the third wave, we now have to think again about how that, whether that can continue. The good thing is the president announced that he will maintain level 1 restriction in terms of movement, in terms of people, like business hours and related things. But that helps in a way because we don't have level 5 lockdown that shuts down everybody and says you cannot move around after a certain time and you close down certain businesses. So now I think the government has become more lenient in their response. So we are maintaining businesses as they were 2 months ago, even though there's Omicron now. The situation might change, I'm not sure, but at least for now, in the response to Omicron, we are likely to have the economic impact might be lessened compared to the third wave with Delta and the first variant.
Okay, so from your understanding, the current government decision is to keep the economy open and running as much as possible, given the current situation of the virus. But of course, as you say, this might change if Omicron situation deteriorates even more. Okay. So what sort of policy or supports government is currently providing to individual households, but also to companies or industries?
So in terms of the individual households, I think we've got very good social welfare policies for a country, for an African country. So even outside of COVID, we had grants for the elderly. We have grants for children, child grants. So if you are unemployed and you've got children up to 18 years, you can get grants for those children. And then if you're over 60, you can get a grant. That's the grant for the elderly. So there is that social welfare mechanism. But now the problem is for those that are not children, that are not 60 and older, they are in the gap, and the unemployed are in the gap because of the economic impact of COVID. There's a very high unemployment rate. I think the statistics released yesterday, 2 days ago, were saying youth unemployment is sitting at 34%. So already you can see the challenge. Those are 18 to around 35, but they don't qualify for those two grants. So there was during the COVID, I think third wave, there were moves to extend social grants to this population, the unemployed, of 350 rand. But in the latest Minister of Finance budget statement, they did not commit to the extension of this grant. So that already is a risk. And given the high unemployment rate, it means this population, this 34% of the population that is neither old nor young, are going to be faced with challenges in terms of financial sustainability of their household.
I see. And what are government's policy or support in towards industries and companies?
There was a fund, the social, I'm trying to remember now, it's called the Solidarity Fund. I'll have to confirm, I can't remember now the exact name. So there was a fund right at the beginning of COVID that was set up to assist industries and to assist small businesses. There's been concerns that not everybody that needed that money could access it, but at least the intention was there, the policy was there. The challenge might be implementation, but the thinking around how to assist industries, coming up with this fund, I think for me that shows intentionality. It shows a willingness to assist the industry. So that process at least was easy, even though it might not reach to everybody that requires it.
I see. So now I want to take a deeper dive into Chinese enterprises and industries in South Africa. So first of all, I would like to know, as far as you know, like what's the presence of Chinese companies and industries in South Africa is like? What kind of industry are they mostly in, and how integrated are they with the local economy, and do they employ a lot of local South Africans, and how are the relationship between these Chinese companies with the South African employees, maybe with local politicians, and with just the public in general?
I'm not very familiar with the specific Chinese industries in this country, probably because they don't stand out any differently from a local company.
I see. Okay.
So I won't be able to tell you the employment policies. But I know, like in any country, we've got China City, for example, where we get quite a few Chinese in the formal sector. But there's also Chinese, I'm sure, in the formal sector. So I'm not quite sure. I cannot give you exact details of their businesses here.
It's all right, no problem. I just give it a try.
That's outside of my, yeah. But there isn't any discrimination, I think, in terms of Chinese industries versus non-Chinese industries. I haven't seen any. I haven't heard. I haven't seen it in the media. So they would thrive just as well as the next company in South Africa.
Okay, and also, then I want to ask, since the outbreak of COVID until now, are there any media or press regarding Chinese companies or industries in South Africa? And also in particular, are there any bad press, maybe, for instance, Chinese companies not paying South Africans or mistreating South Africans' employees, etc., or any other relevant news or press that covers Chinese companies, as far as you're aware?
Not that I'm aware of. No, I haven't read in the media anything relating to Chinese companies.
That's all right. That's all right. I just give it a try.
Yeah, I think there was one isolated case of, I think remember when Donald Trump was calling this a Chinese virus. Back when it started, I think I did hear of Chinese people feeling uncomfortable in certain spaces because of that. But it really didn't pick up. I think people moved on very quickly, and it hasn't been like a Chinese versus everybody else in terms of COVID. So I think in as far as the social solidarity and how Chinese are treated in South Africa, that I haven't seen any specific issues. Even when there are flare-ups of xenophobic attacks, it's normally Black Africans that are the target, not so much Chinese people. Yeah.
I see. Okay, so this so far then, so in terms of the economy of South Africa in terms of import exports, would you say how much South Africa is dependent, or how much of a South African economy is integrated with Chinese companies or industry or import-export of China, as far as you see and understand and observe?
I think from my observations, there is a fair amount of Chinese products locally. Your plastics, even PPEs, your masks and things like that, most of them are imported from China. In the medical space, I think some of the pharmaceutical ingredients are imported from China. I think mostly in your clothing as well, because there's been concerns that the clothing industry in South Africa is suffering because of the cheaper Chinese imports. So there's quite a greater involvement or greater amount of imports from China into the local economy.
I see. And
so that's I think.
I see. And generally, for the average consumer in South Africa, like the Chinese brand or products from China, do not have any stigma or are not liked by local residents.
Well, you do get the odd cheap Chinese imports kind of brand when people refer to Chinese products as cheap Chinese imports. But I think people will buy what they can afford.
Okay.
So as you can imagine, the South African population is mostly, there's such vast inequality. So the majority is not as wealthy. So those that can afford African products or the more expensive products from, let's say, Europe, they'll buy those. But a large population will buy the Chinese products because that's what they can afford.
I see.
So you don't get that. I don't think people discriminate at that level to say this is Chinese, therefore I'll not buy. They say this is what I can afford, I'll buy it, whether it's Chinese or local.
I see. Okay. So before I conclude this topic on economics, I just want to ask you again in terms of your personal prediction on the trajectory of the virus and also the impact of the economy. Of course, like data is still limited, but from say your experience or even can be your personal hunch, how would you feel in terms of will the Omicron virus become so severe as to it necessitates a national lockdown, say in this coming within this coming month?
I don't believe that we'll go to that extreme route of a national lockdown. I'll tell you why. Because now we've seen the economy suffer. It's teetering on the brink of, it's been quite bad, and the rand-dollar exchange hit its lowest level just this last week. You can't afford, from an economic point of view, you can't afford to have a massive lockdown. And secondly, from a political point of view, people were very unhappy because we had elections and life was going on as normal. Now you say people should lock down, should move around. So it will seem like I think the masses would not take kindly to that. And also it's towards December. That's the second thing. And thirdly, vaccines are available to everyone who needs them. So why lockdown instead of forcing people to mandating people to vaccinate? So the circumstances on the ground now compared to last year or compared to the first wave are very different. Now we have vaccines. So rather force people to vaccinate than close down an entire economy because people don't want to vaccinate. So I think the government has many options now compared to the last time. So I don't foresee a total lockdown in the country. If it does happen, it might be because the hospitals are overrun. But I think we have enough options to work with now compared to the last time.
Yeah, so seems the obvious trajectory and policy would be, say, a partial lockdown. Lockdown
so
at worst,
just move to level.
And also, how would you comment on South Africa's government efforts to do contact tracing, and of course, maybe do in terms of tracking of infected population? So, how would you say how effective and how's the government's effort in this area?
So, right now, in terms of contact tracing, it's obviously not as effective because we've got higher numbers of people that are affected by COVID. But in terms of reporting, it's mandatory that if you test positive, the pathology labs have to report that to the government. So that gives them a sense of how bad or how severe the infectivity of COVID is. So the data, the statistics are very good in terms of how they collect the data. So at any given point, the government knows who is infected and how many, gender, age, and location. So I think that in terms of the data part of things, that's good.
I see. So at the moment, the system is by people doing a verbal reporting. There's no, say, technology platform that uses technology to do contact tracing. Am I correct?
No. There is. It's not reporting verbally. There is a platform where all the results are collated. So there is a platform, and at any given point, the government knows who is infected and how many people are in hospital because of COVID. So there is. We've developed a very good data system of collecting A, the results from the labs, and B, the admissions from the hospitals, and C, the mortality. So I think, if anything, COVID has pushed us to develop that platform, which is a very data centered, and it gives us in real time how many cases we have at any given point.
Okay, so in terms of that platform, what kind of devices is feeding data to this platform? Is it by people, or is it by mobile phones, or other sources?
So when you go when they do your blood sample, they do your COVID sample and send it to the lab. The labs are connected. I'm not sure what they use, via an API or whatever mechanism. Then they submit the data directly to NICD.
I see. So the platform you mentioned is connected to labs, for testing labs. I see. Okay.
Yes. For labs and also hospitals.
I see. Lab and hospitals. Okay. So I think with this, I conclude the topic on the economy and, of course, other previous topics as well. Now, let's proceed to the topic on first of all, the first COVID investigation on China. So mostly this is more on your own personal opinion. Of course, I also know that you also work for WHO, so if you also know maybe the internal positions or the opinions of your fellow colleagues regarding the investigation of origins of COVID, the first investigation on China. So, of course, the result is that, for instance, in terms of it's highly likely that transmission come from transmission from animal to human beings, and the likelihood of outbreak from the laboratory, it's very low. So regarding, say, this the results of these findings, and also the the quality of the work conducted by the investigation team and committee. What's your opinion on them? Like, do you say believe the results, or do you think that in what ways the investigation can be done better, or maybe say other parties should be involved?
On that, unfortunately, I'm not working with that group of guys at the WHO. I'm more on the health financing unit. So I haven't been very close to the investigations or even the outcomes. So I really can't comment on that specific part of the investigation.
Okay, then you can just share your own opinion, just a way as for us to gauge, say, the opinion of, say, average medical professional or people who work in the healthcare industry. That would too be helpful as well.
So, okay, so you want to know my sentiments in terms of the spread, how it started?
Yes.
Oh, okay. So I think I'll give you my opinion as a healthcare professional. I do believe that, like most viruses, we will get viruses jumping from animal species to humans.
Mm-hmm.
So I'm not sure that it serves us to go back to find out how it started, rather than spending resources in addressing this, in stopping the spread and finding solutions. So I think, for political reasons, it might serve certain political agendas to find out, was it China, was it not China, was it deliberate, was it not deliberate. But for me, what I think is we should be spending more resources in trying to control and manage this, the same way we did with HIV. We could spend years trying to find out whether HIV was deliberately spread to humans, into Africans, for example. But it doesn't get us anywhere. Rather, let's focus on getting the cures, because these viruses will mutate over time. That is a given. Doesn't matter. And I'll tell you why, for me, it's really frustrating. Because you would have heard that with the Omicron, we're the targets. We're told South Africans cannot travel because we are the source of the virus. But we're not. We just discovered it. It didn't start in South Africa. So it is that mindset that takes us back. It is that mindset that stops us from finding solutions, because we're eager to point fingers instead of finding solutions. So those are my personal views anyway in terms of this.
I see. And also, thank you very much. That's very frank. And also, in terms of second part of this question, because whether it's because the first investigation is inconclusive, and also, of course, partly due to international pressure. So WHO is now conducting starting a second investigation, maybe again in China, but also in other regions of the world that may be potentially be the origins of the virus. So, because a Chinese position is that one or two Chinese agencies they are speaking out and they are advising against China opening up for a second round of investigation, because they think that one investigation is already enough. So, what's your in terms of our own opinion, what do you think of in terms of China's attitude to this potential second investigation? And also, if this second investigation by WHO, should it go back to China and then do a second round? And if so, should China cooperate?
I think in terms of cooperation, because WHO is a neutral agency that's supposed to serve all of us. So from that point of view, I think everybody to cooperate, because we're trying to get the answers. The concerns that China might have in terms of being singled out, maybe those are valid, those can be addressed, but they are, in my view, they shouldn't be enough to stop a second investigation. It could be that maybe certain information has come up and they want to corroborate the first investigation's findings. So I don't think if it's approached in the spirit of finding out what happened versus blaming, I think China should cooperate, as should other countries. And I don't believe that it's going to be China only. It's going to be other countries, because from my understanding, there were some of these cases were also detected around the same time that detected in China and other countries. So those countries should open themselves up to participate in this inquiry. And I don't even think it should be an investigation. It's more an inquiry to find out the origins and probably map it to the original source. So in my view is everybody should cooperate, obviously in the spirit of finding answers rather than finding people to blame.
I see.
Yeah.
Thank you very much. Like, your opinion has been very helpful and very enlightening as well.
All right.
Okay, so I think with that, this also concludes the final topic of inquiry in this interview. So let's see. Yep. So Dr. Su Liu, thank you very much for your time. So you've mentioned that previously you can find out some of the figures and numbers afterwards, and I'm not sure if you can say if you can find out those numbers and then just relegate and then just send those numbers to your correspondence with GuidePoint, so that they can forward those information to me later on, if possible.
I'll do that.
Okay, thank you very much for your time.
Thank you. Thank you for the opportunity.
Yep, it's been my pleasure. Okay, and
thank you.
Have a good day.
Thanks, you too.
Yes, and goodbye.
Bye for now.